We're delighted to welcome our expert speaker this week. We have Katherine Rushfirth. She is a certified nurse midwife with a long-held commitment to health equity and social justice.
Oh, thank you so much for inviting me and having me. I'm really excited to be in community with you all.
Thank you, thank you. So we would love to hear your story and how you got into all of this work.
And I had really never even heard of a midwife. Like I had never sort of connected that, midwives were here in the United States. But my senior year, I wrote a thesis on teen pregnancy and kind of our cultural understandings or historical understandings of teen pregnancy. And I had to do field research. I had to do interviews. And so I ended up interviewing midwives up in Washington Heights and at Boston Medical Center. And the way they spoke about their patient, their clinical care, their perspectives on kind of the social issues, like I was like, oh, this is perfect. Like I should just be this. And so I began to really look for and really start to engage with the idea that certain organizations and certain movements were not just about reforming or making slight improvements to the system, but completely reimagining the system, completely reimagining how we do healthcare, reimagining how we do birth, how we do reproductive justice. And as luck would have it, because I had been so politically engaged over the years around midwifery, I had crossed paths many times with 𝐁𝐁𝐵𝐻𝐻 Burrell, who is the executive director of the Neighborhood Birth Center. So I knew that 𝐁𝐁𝐵𝐻𝐻 was out there, and I knew that there was work to try and open and develop a freestanding birth center in Boston. And she and I were talking, and it just was fortuitous that she was like, we've just gotten this, we've just gotten some funds to bring on a midwifery consultant to help us flesh out our business plan and our clinical model. Certified nurse midwives at this point attend 9% of births in the US. That is probably the inverse of what it would be in most of Europe. So most of the world, midwives are who are the default providers for pregnancy and birth. So it's really, really striking in the US that we are attending so few births. So the more they sort of scored it, the more integrated midwives were in your state. Actually, it was shown to improve every perinatal health outcome. So it improved maternal mortality and morbidity, infant mortality, preterm birth, cesarean section, healthcare spend. All of it. Everything improves when you get more midwives integrated. So you still have the American Medical Association with their Stop Scope Creep, fighting independent practice for advanced practice clinicians. We're still struggling with the American Medical Association or the American College of OB/GYNs in very meaningfully licensing, empowering, recommending midwifery.
Night, or is it like you're in, you give birth,
yeah,
you're followed up, you go home? Kind of what does it look like?
So birth center for birth, it really is for people who are looking for what we call physiologic birth. So low intervention birth that starts on its own and it is without an epidural. So that if that is something that's important to people, then you can go see that would be a great example of going to see a hospital-based midwife.
Yeah.
And Katherine, do you foresee, establishing those lines to transfer? Is that going to be difficult as you guys?
No,
is that going to be pretty seamless and you'll feel supported?
I think the conversation has definitely changed in the last 10 years from hospitals. So we actually have a signed transfer agreement with Boston Medical Center. So we have already established that for Boston Medical Center will be our go-to in terms of transfers. Mm-hmm. And then we've also started having conversations with Mass General Hospital so that, if most transfers, 99% of transfers from birth centers are non-emergent.
And I love your question, Katherine, about the question that should be foremost in our minds is what kind of healthcare do you want for your family members and yourself? And that is I found that so powerful. And if we all just could hold on to that, I think.
I have a lot of friends, they're nurse practitioners. I'm like, you guys should have known better. But a lot of them have seen obstetricians because they just that's their local hospital. That's my gynecologist, whatever it would be. And I think later when they reflect on their birth experiences, they're like, oh, I didn't think to ask that. It didn't occur. I think sometimes people, it's almost in retrospect that they do think about things like that felt rather disempowering, or weren't really valuing shared decision making and those type of things.